10 liver-destroying foods you should avoid. Welcome to our channel. Today, we're exploring a vital aspect of health, the liver. As your body's ultimate multitasker, the liver tirelessly filters toxins, aids in digestion, and stores energy, making it indispensable to your overall well-being. However, what you consume directly impacts its health. Your diet can either support the liver's functions or contribute to serious conditions like fatty liver, hepatitis, and even liver failure. Understanding which foods to avoid is crucial for maintaining optimal liver health. From sugary treats to processed snacks, certain foods pose risks to this essential organ. In this video, we'll delve into 10 foods notorious for harming your liver if consumed excessively. We'll discuss how these foods affect liver function, which bodily processes they impact, and why it's imperative to moderate or eliminate them from your diet. Stick around until the end where we'll reveal a list of foods that actively promote liver health. Let's embark on this journey to better liver health together, starting now. 1. Artificial sweeteners. Have you ever wondered how artificial sweeteners affect your liver? Artificial sweeteners like aspartame, saccharin, and sucralose are commonly used as sugar substitutes, but they may wreak havoc on your gut health, indirectly impacting your liver function. These sweeteners can disrupt the balance of beneficial bacteria in your gut, leading to a condition called dysbiosis, where harmful bacteria outnumber the good ones. This imbalance can increase intestinal permeability, allowing toxins like endotoxins to enter the bloodstream and reach your liver. Once in the liver, these toxins force it into overdrive, triggering inflammation and oxidative stress. This stress can damage liver cells and impair its ability to function properly. What's more, artificial sweeteners can induce metabolic changes in the liver, negatively affecting its processes. Consuming these sweeteners might lead to insulin resistance, where your body's cells become less responsive to insulin. This resistance prompts the liver to produce more glucose and store extra fat, potentially leading to non-alcoholic fatty liver disease. As fat accumulates in the liver, inflammation and cell damage can escalate, progressing to more severe conditions like non-alcoholic steatohepatitis, fibrosis, and even cirrhosis. 2. High-sodium foods. Did you know that consuming too much sodium can impact your liver health? High levels of sodium in your diet can lead to elevated blood pressure, a condition known as hypertension. This increase in blood pressure places added strain on the liver, as it works harder to manage the increased blood flow. Over time, this strain can damage the liver's blood vessels, impairing its ability to effectively filter toxins and process nutrients. In addition to hypertension, high sodium intake causes the body to retain more water, leading to increased blood volume. This water retention further burdens the liver, potentially causing swelling and inflammation. As a result, the liver becomes less efficient at its vital tasks of filtering blood and metabolizing nutrients, which can worsen existing liver conditions or contribute to the development of new ones. Furthermore, high sodium levels can induce cellular stress within the liver. Sodium disrupts the balance of electrolytes within liver cells, leading to cellular dysfunction and triggering oxidative stress. This stress occurs when reactive oxygen species accumulate and damage liver cells, proteins, and DNA, contributing to liver inflammation and conditions like non-alcoholic fatty liver disease and liver fibrosis. Research has shown that consuming more than 9.5 grams of salt per day is associated with a higher risk of developing non-alcoholic fatty liver disease. 3. Sugary foods and beverages. Ever wondered how sugary foods and drinks affect your liver? When you consume these treats, they often pack a punch of fructose, glucose, and sucrose. Fructose, in particular, is primarily metabolized in the liver. Unlike glucose, which can be processed by various cells in the body, fructose undergoes transformation into fat within liver cells. This process can lead to the accumulation of fat, known as non-alcoholic fatty liver disease. Over time, this buildup of fat can trigger inflammation and damage to liver cells, potentially progressing to more serious conditions like non-alcoholic steatohepatitis, fibrosis, and even cirrhosis. Additionally, a high intake of sugary foods and beverages may contribute to insulin resistance. Insulin is crucial for regulating blood sugar levels, but excessive sugar intake can reduce the body's responsiveness to insulin, prompting the pancreas to produce more. This insulin resistance leads to elevated levels of both insulin and glucose in the bloodstream, further promoting fat storage in the liver. Such conditions exacerbate non-alcoholic fatty liver disease and heighten the risks of liver inflammation and damage. Research has shown that increased fructose consumption significantly raises the likelihood of developing non-alcoholic fatty liver disease. 4. Processed foods. Have you ever wondered about the impact of processed foods on your liver? Trans fats, found abundantly in snacks, fast food, and baked goods, are artificially created through hydrogenation to prolong shelf life. Despite their convenience, these fats pose a challenge for the liver, which struggles to break them down and process them efficiently. Over time, consuming trans fats can lead to the accumulation. This buildup can progress to more severe liver damage. Moreover, processed foods often contain a cocktail of artificial additives like preservatives, flavor enhancers, and colorings. These chemicals add an additional burden. Constant exposure to these additives may trigger liver inflammation, compromising its vital functions. 5. Fried foods. Fried foods are often loaded with unhealthy fats, particularly trans fats and saturated fats. Consuming these fats in excess overwhelms the liver's ability to metabolize them efficiently, leading to the buildup of fat within liver cells. This fat accumulation can trigger liver inflammation and scarring, impairing liver function and increasing the risk of serious liver conditions. Moreover, the high-temperature frying process produces harmful compounds like advanced glycation end products, AGEs, and acrylamide. AGEs form when proteins or fats combine with sugars during cooking, contributing to oxidative stress and inflammation in the liver. Acrylamide, another harmful compound formed at high temperatures, may also contribute to liver toxicity, damaging liver cells and impairing detoxification processes. Additionally, fried foods are calorie-dense, which can contribute to obesity and metabolic syndrome. Both conditions are major risk factors for developing non-alcoholic fatty liver disease, NAFLD. Excess body weight and metabolic imbalances strain the liver further, promoting fat accumulation and inflammation. As the liver struggles to manage the excess calories and fat intake, its ability to function properly diminishes, heightening the risk of liver disease. Research indicates that a significant portion of patients with hepatic steatosis, or fatty liver disease, consumed higher amounts of fried foods compared to those without the condition. 6. White bread and rice. Both these foods have a high glycemic index, meaning they can cause rapid spikes in blood sugar levels after consumption. When you eat high glycemic index foods, your body quickly converts them into glucose, leading to a sudden increase in blood sugar levels. This spike triggers the pancreas to release large amounts of insulin to help cells absorb the glucose. Over time, these frequent spikes in blood sugar and insulin levels can overwhelm the liver's ability to regulate glucose properly. This imbalance can result in the liver converting excess glucose into fat, leading to a condition called non-alcoholic. Furthermore, white bread and rice are low in dietary fiber, which is essential for healthy digestion and stable blood sugar levels. The lack of fiber means these foods do not slow down the absorption of glucose, exacerbating the spikes in blood sugar and insulin levels. This places additional strain on the liver as it tries to manage these fluctuations, contributing further to fat accumulation and inflammation. A diet low in fiber can also impact gut health, indirectly affecting liver function by promoting systemic inflammation. 7. Red meat. Red meat is rich in saturated fats, which pose a challenge for the liver to process efficiently. Consuming large amounts of saturated fats can lead to the accumulation of fat in the liver, a condition known as non-alcoholic fatty liver disease. This buildup of fat within liver cells triggers inflammation and can cause damage over time. Furthermore, red meat contains high levels of cholesterol, another factor that can contribute to liver damage. Excessive dietary cholesterol may lead to the formation of cholesterol deposits in the liver, which can cause inflammation and impair liver function. High cholesterol levels in the blood may also contribute to the development of gallstones, obstructing bile flow and adding further stress to the liver. In addition to saturated fats and cholesterol, red meat is a significant source of heme iron, which is more easily absorbed by the body compared to non-heme iron found in plant-based foods. While iron is essential, excessive intake of heme iron can lead to iron overload in the liver, a condition called hemochromatosis. This can result in the accumulation of iron in liver cells, causing oxidative stress and cell damage. The cumulative effects of saturated fats, cholesterol, and heme iron in red meat can severely impair liver function and increase the risk of liver diseases such as cirrhosis and liver cancer. 8. Carbonated beverages. Carbonated beverages, especially those high in fructose and other sugars, can have detrimental effects on liver health. When you consume these drinks, the liver metabolizes the fructose, converting it into fat. This process can lead to the accumulation of fat within liver cells, a condition known as non-alcoholic fatty liver disease, NAFLD. The liver's struggle to process these excess sugars also results in oxidative stress, causing further damage to liver cells. Moreover, carbonated beverages often contain artificial additives like preservatives, flavor enhancers, and colorings. These chemicals add to the burden on the liver, which works overtime to detoxify and eliminate them from the body. Continuous exposure to these additives may lead to liver inflammation and increased oxidative stress, further impairing liver function over time. The resulting oxidative stress can damage liver cells, leading to ongoing inflammation and potentially worsening liver health. The liver's attempts to repair this damage may lead to more inflammation and scarring, exacerbating liver conditions. Additionally, frequent consumption of carbonated beverages is associated with an increased risk of metabolic syndrome, a cluster of conditions including obesity, insulin resistance, high blood pressure, and abnormal cholesterol levels. Metabolic syndrome is a significant risk factor for developing NAFLD and can progress to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, and liver fibrosis. 9. High-fat dairy products. High-fat dairy products often contain significant amounts of saturated fats, which pose a challenge for the liver to process efficiently. When you consume saturated fats, they can accumulate in liver cells, leading to the development of non-alcoholic fatty liver disease, NAFLD. This condition arises from the excess buildup of fat in the liver, which can cause inflammation and damage to liver cells. Continued consumption of saturated fats can exacerbate this fat accumulation over time, potentially progressing to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis. Additionally, high-fat dairy products are rich in cholesterol. Excessive dietary cholesterol may contribute to the formation of cholesterol deposits within the liver, triggering inflammation and impairing liver function. Elevated cholesterol levels in the bloodstream can also increase the risk of developing gallstones, which may obstruct bile flow and add further stress to the liver. The liver's efforts to process and eliminate excess cholesterol can lead to ongoing inflammation and scarring, worsening liver health. Research involving 7,500 participants has shown that those consuming higher amounts of dairy, cheese, and yogurt had elevated fatty liver index levels. This underscores the potential impact of high-fat dairy on liver health. 10. Alcohol. Alcohol itself is a toxin, and when the liver metabolizes it, it converts alcohol into acetaldehyde, a highly toxic substance. Acetaldehyde can damage liver cells, leading to inflammation and scarring. This damage disrupts the liver's normal functions, impairing its ability to process nutrients and filter toxins from the bloodstream. Moreover, the metabolism of alcohol in the liver produces reactive oxygen species, ROS, harmful molecules that cause oxidative stress. Oxidative stress occurs when there's an imbalance between ROS production and the liver's detoxification capacity. Over time, this stress can damage liver cells, proteins, and DNA, contributing to ongoing inflammation and eventual cell death. These effects can lead to significant liver injury, contributing to conditions like alcoholic hepatitis and cirrhosis. Additionally, excessive alcohol consumption disrupts the liver's ability to metabolize fats properly, leading to the accumulation of fat within liver cells. This condition, known as fatty liver disease, is an early stage of alcohol-related liver disease and can progress to more severe conditions like alcoholic hepatitis. As fat continues to accumulate, it causes further inflammation and scarring, progressively impairing liver function. Experts suggest that even moderate alcohol intake, such as 20 grams per day for women and 30 grams per day for men, can worsen liver damage. It's crucial to be aware of these risks and consider healthier alternatives for liver health. Now that you understand the potential risks of certain foods and drinks for your liver, it's crucial to prioritize liver health in your diet. Here are 5 foods and drinks known to support and protect your liver. 1. Green tea. Known for its antioxidant properties, green tea can help reduce fat accumulation in the liver, promote liver function, and protect against liver diseases. 2. Fatty fish. Rich in omega-3 fatty acids, fatty fish like salmon, mackerel, and sardines can help reduce inflammation and support liver function. 3. Leafy greens. Vegetables like spinach, kale, and arugula are packed with vitamins, minerals, and antioxidants that support liver detoxification and overall health. 4. Turmeric. This spice contains curcumin, a compound with powerful anti-inflammatory and antioxidant properties that may help protect liver cells from damage. 5. Coffee. Studies suggest that moderate coffee consumption may lower the risk of liver diseases such as cirrhosis and liver cancer, thanks to its beneficial compounds. Incorporating these foods and drinks into your diet can help maintain and promote liver health. 8 signs of liver disease at night you shouldn't ignore. Did you know that liver disease doesn't take a break when the sun goes down? In fact, nighttime can reveal a unique set of symptoms that are crucial for anyone with liver disease to recognize. Identifying these signs can help you stay on top of your health and ensure a good night's sleep. In this video, we'll uncover the often hidden signs of liver disease that can appear at night. These nighttime symptoms offer important clues about potential underlying health issues. If you're experiencing any of the symptoms mentioned, please share your experience in the comments below. Let's raise awareness and support each other on this health journey. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. Number 1 on our list, nighttime muscle cramps. These cramps can be more than just a painful nuisance, they might be a signal of an underlying liver issue. Imagine being jolted awake by a sudden, intense cramp in your leg. Your muscle tightens and contorts painfully, leaving you rubbing and stretching in a desperate attempt to find relief. These cramps can last from a few seconds to several minutes and can recur multiple times throughout the night, making restful sleep seem impossible. The liver is essential for maintaining a balance of electrolytes and minerals in your body, which are crucial for proper muscle function. When the liver isn't functioning correctly due to disease, it can lead to imbalances in electrolytes like calcium, potassium, and magnesium, causing muscles to cramp and spasm. Additionally, liver disease can result in poor circulation and reduced oxygen supply to the muscles, further contributing to the frequency and severity of muscle cramps. To help manage and prevent nighttime muscle cramps, include foods rich in essential minerals like potassium, magnesium, and calcium in your diet, such as bananas, leafy greens, nuts, seeds, and dairy products. Avoid excessive alcohol and salty foods, as they can disrupt your electrolyte balance. Drink plenty of water throughout the day, and consider keeping a glass of water by your bedside in case you wake up thirsty. Gentle stretching exercises before bed can help relax your muscles and reduce the likelihood of cramps, especially focusing on your legs and feet. If you experience a cramp, massaging the affected muscle and applying warmth, like a warm towel or heating pad, can help alleviate the pain and relax the muscle. Number 2 on our list is itchy skin. Picture this: you're cozied up in bed, drifting off to sleep, and suddenly you're hit with an intense urge to scratch. It's not just a mild itch, it's an unrelenting need to scratch that keeps you awake and frustrated. This itchiness can be localized or widespread and often feels more intense at night, disrupting your precious sleep. So, what's the deal with this nocturnal itching? Liver disease can cause a buildup of bile salts in your bloodstream. Normally, your liver processes these bile salts to aid digestion. However, when your liver is compromised, it can't filter out these substances efficiently. As a result, these bile salts accumulate and deposit under your skin, causing that relentless itch. If itchy skin is becoming a nightly struggle, here are some tips that might help. Use a good quality moisturizer to keep your skin hydrated, as dry skin can exacerbate itching. Apply lotion generously, especially after bathing. Hot water can strip your skin of natural oils and worsen the itching, so opt for lukewarm showers and use gentle, fragrance-free soaps to keep your skin calm. Over-the-counter anti-itch lotions or creams containing ingredients like menthol or camphor can provide temporary relief. Antihistamines might also help, but consult with your healthcare provider before taking any new medication. Keeping your bedroom cool can help reduce itching. Use a fan, lightweight bedding, and wear loose, breathable pajamas to keep your skin comfortable. In some cases, medications that reduce bile salts or address liver function may be necessary. Your healthcare provider can advise you on the best course of action based on your specific condition. Number 3 on our list is night sweats. If you're waking up in the middle of the night drenched in sweat, with your pajamas sticking to your skin and your sheets damp, you may want to look into why. These episodes can range from mildly annoying to severely disruptive, making it hard to get a good night's rest. Night sweats in the context of liver disease can be attributed to several factors. The liver is responsible for filtering toxins from the blood. When it's not functioning properly, these toxins can accumulate in your system, potentially causing your body to react with night sweats. Additionally, liver disease can disrupt the balance of hormones in your body, including those that regulate temperature, leading to excessive sweating, particularly at night. Chronic liver disease can sometimes be associated with low-grade infections or inflammation, which can cause your body to produce sweat in an attempt to regulate temperature. The liver also plays a key role in metabolism. Liver disease can alter metabolic processes, leading to changes in body temperature regulation and causing night sweats. It's important to speak with your doctor to determine if liver disease is the cause of your night sweats. They can run tests to diagnose liver problems and recommend appropriate treatments. Eating a balanced diet can support liver health, so focus on foods that are rich in antioxidants, vitamins, and minerals. Avoid alcohol and limit consumption of fatty, fried, and sugary foods. Spicy foods and caffeine can trigger sweating, so try to avoid these, especially in the evening, to reduce the likelihood of night sweats. Number 4 on our list is insomnia. Imagine lying in bed, staring at the ceiling, and counting endless sheep with no sign of sleep in sight. Your mind races, your body feels restless, and as the hours tick by, you get more and more frustrated. Even when you do manage to drift off, it's a fitful sleep that leaves you feeling exhausted the next day. So, what's the connection between liver disease and insomnia? The liver plays a crucial role in detoxifying your blood and managing various metabolic processes. When liver function is impaired, toxins can build up in the bloodstream and affect brain function, leading to a disruption in your body's natural sleep-wake cycle, making it difficult to get a good night's sleep. Additionally, liver disease can cause imbalances in hormones and neurotransmitters, such as melatonin and serotonin, which are critical for regulating sleep. These imbalances can further contribute to insomnia. If insomnia is becoming your nightly nemesis, here are some tips to help you manage it. It's essential to see your doctor if you're experiencing persistent insomnia. Blood tests can help determine if liver disease is the underlying cause, and your healthcare provider can recommend appropriate treatments. Establishing a calming pre-sleep routine can help signal to your body that it's time to wind down. This might include activities like reading, taking a warm bath, or practicing gentle yoga or meditation. Try to go to bed and wake up at the same time every day, even on weekends. Consistency reinforces your body's sleep-wake cycle. The blue light emitted by phones, tablets, and computers can disrupt your body's production of melatonin, making it harder to fall asleep. Aim to turn off screens at least an hour before bedtime. Make your bedroom a haven for sleep by keeping it cool, dark, and quiet, and invest in a comfortable mattress and pillows. Before we cover the next symptom, don't forget to like and subscribe. Number 5 on our list is restless leg syndrome, RLS. Restless leg syndrome can be a real nighttime nuisance, and it might surprise you to know that it can be linked to liver disease. Imagine settling into bed, ready for a good night's sleep, and suddenly feeling an uncontrollable urge to move your legs. It's like having ants in your pants, except they're actually in your legs. These sensations can range from a mild tickle to an aching or even a creepy, crawly feeling that just won't quit. The result? Tossing, turning, and a serious case of the sleepless blues. So, why does this happen? Liver disease can cause peripheral neuropathy, a condition where the nerves outside your brain and spinal cord are damaged. When your liver isn't functioning properly, toxins can build up in your bloodstream, which can harm these peripheral nerves. This nerve damage sends jumbled signals to your brain, tricking it into thinking your legs need to move constantly to relieve the discomfort. If RLS is keeping you up at night, it's important to address it. Ensure you're getting enough nutrients, particularly those that support nerve health, like iron, magnesium, and B vitamins. Avoid alcohol, as it can worsen liver function and nerve damage. Keep a regular sleep schedule and create a calming bedtime routine. Reducing stress and practicing relaxation techniques can also help. Drink plenty of water throughout the day to help your body flush out toxins and maintain overall health. Number 6 on our list is waking up with nausea. You're in the middle of a deep sleep when suddenly you wake up with a queasy, unsettled feeling in your stomach. You might feel like you're on the verge of vomiting, and the sensation can be accompanied by a sour taste in your mouth or excessive salivation. This discomfort can make it hard to get back to sleep, leaving you tired and frustrated. One of the liver's primary roles is to filter out toxins from the blood. When the liver is not functioning properly, these toxins can accumulate and affect various bodily functions, including digestion. This buildup of toxins can lead to feelings of nausea, particularly at night. Liver disease can disrupt bile production and flow, leading to digestive issues such as indigestion or acid reflux, which can cause nausea. Additionally, liver disease can alter the balance of hormones in your body, including those that regulate digestion and appetite, further contributing to nausea. If you're waking up with nausea, here are some steps you can take to manage it. Consult your doctor, who might recommend medications or supplements to help manage nausea. Always follow their advice for safe and effective treatment. Using extra pillows to elevate your head can help prevent acid reflux, which can cause nausea during the night. Maintaining a healthy diet, avoiding late-night meals, and steering clear of foods that trigger indigestion can also help. Number 7 on our list is frequent urination. Next up in our nocturnal adventures is finding yourself sprinting to the bathroom multiple times during the wee hours. It might be more than just an annoying disruption to your sweet dreams. It could be a signal from your body about liver issues. Liver disease can cause fluid retention and diuretic effects, leading to increased urine production, especially at night. When the liver is not functioning properly, it can lead to an imbalance in the body's fluid regulation. This often results in the accumulation of fluid in the tissues, known as edema. To compensate, your body might increase urine production to get rid of the excess fluid, causing you to wake up frequently during the night to urinate. This frequent urination can severely disrupt your sleep, leaving you feeling exhausted and irritated during the day. To manage this symptom, it's essential to adopt some practical habits. Limiting your fluid intake in the evening can reduce the likelihood of needing to urinate during the night. It's also wise to avoid beverages that can act as diuretics, such as those containing caffeine and alcohol, as they can increase urine production. By addressing the root cause and making lifestyle adjustments, you can reduce the frequency of nighttime urination, ensuring better sleep and overall well-being. Number 8 on our list is darker urine. Waking up to find your urine is dark brown or tea-colored instead of the usual pale yellow can be alarming and may indicate an underlying health issue, such as liver disease. This change in urine color can be quite unsettling, especially if it happens frequently. Dark urine can be accompanied by other symptoms like a strong odor, fatigue, or abdominal discomfort, making it even more concerning. In the context of liver disease, dark urine is typically due to the buildup of bilirubin, a yellow compound that forms as red blood cells break down. Normally, the liver processes bilirubin, which is then excreted in bile and removed from the body through the digestive tract. When the liver is damaged, it cannot process bilirubin effectively, leading to its accumulation in the blood. This excess bilirubin is then excreted through the kidneys, causing the urine to appear dark. Liver disease can also cause dehydration, which concentrates the urine and makes it appear darker. This is particularly noticeable when you haven't had enough fluids, such as first thing in the morning. Certain medications or toxins that affect liver function can also cause dark urine. If the liver is struggling to filter these substances out, they can change the color of your urine. In severe cases, dark urine may contain blood due to complications of liver disease, such as bleeding disorders. This requires immediate medical attention. It's crucial to talk to your doctor if you notice dark urine, especially if it's persistent. They can conduct tests to determine if liver disease is the cause and suggest appropriate treatments. To help maintain liver health and prevent further complications, limit exposure to environmental toxins and chemicals that strain your liver. This includes avoiding excessive alcohol consumption and being cautious with over-the-counter pain relievers and herbal supplements. By understanding these nighttime symptoms of liver disease and taking proactive steps, such as regular checkups and open communication with your healthcare provider, you can better manage your health and overall well-being. The liver, an organ frequently affected by tumors. It's not only a common site for metastasis from various cancers but also prone to developing primary liver cancer. Notably, liver tumors often manifest specific symptoms, aiding in early detection and prevention. In this video, we will delve deeper into the common symptoms of liver tumors. First, we'll look at the imbalance in liver function, evidenced by signs like jaundice, loss of appetite, and unexplained weight loss. These symptoms typically arise when the liver fails to filter and process toxins, indicating that tumor growth might be exerting pressure on or damaging liver cells. Next, we will analyze the sensation of pain or discomfort in the upper right abdomen, where the liver is located. The growth of a tumor can put pressure on surrounding organs, leading to inexplicable pain or discomfort. This could be an early warning sign of tumor development. Finally, we'll discuss the causes leading to the development of liver tumors. Factors such as chronic hepatitis, exposure to toxic substances, or excessive alcohol consumption can contribute to an increased risk of tumor development. Understanding these causes not only helps us in prevention but also aids in identifying effective treatment methods. Now, let's examine each specific sign in more detail. Situation 1. Incidental discovery of liver cancer. As health professionals, we often encounter cases where liver cancer is incidentally discovered during diagnostic tests for unrelated reasons. The most common method of diagnosing liver cancer involves detecting it on an ultrasound or an abdominal CT scan, typically performed during routine checkups or as part of ongoing monitoring for other abdominal diseases. This incidental discovery is significant because liver cancer, especially in its early and sometimes even advanced stages, usually does not manifest any symptoms. Patients incidentally diagnosed with liver cancer often report only a slight decrease in appetite, a very nonspecific symptom, emphasizing the importance of regular health screenings. Situation 2. Enlargement of the liver due to tumor growth. In cases where a large tumor develops in the liver, an increase in the liver's size is observed. The liver, usually shielded by the lower ribs on the right side of the chest, becomes palpable below the last rib during abdominal examination as the tumor grows. This enlargement, while typically asymptomatic, can sometimes cause a sensation of weight or fullness in the abdomen. Due to its increased size, liver cancer is more readily observed in diagnostic tests like ultrasounds or CT scans, illustrating the critical role of imaging in cancer detection. Situation 3. Pain in the upper right abdomen. Liver cancer can induce pain in the upper right quadrant of the abdomen. This pain often presents as a sharp, sudden onset that rapidly intensifies. Typically, it originates from a rupture in one of the blood vessels associated with liver cancer, leading to internal bleeding. This bleeding causes abrupt stretching of the liver's capsule, Glisson's capsule, which activates the pain receptors in the liver. If there's no bleeding, and the tumor grows slowly, this stretching happens gradually, leading to low-grade nerve stimulation, and therefore less noticeable pain or discomfort. This situation highlights the need for vigilance in monitoring even minor abdominal discomforts. Situation 4. Jaundice. One of the hallmark signs of liver cancer is jaundice, where the skin and mucous membranes exhibit a yellowish tint. This occurs when cancer growth disrupts the normal outflow of bile in the liver. The trapped bilirubin then leaks into the bloodstream, elevating blood bilirubin levels. Excess bilirubin tends to accumulate in the skin and mucous membrane's elastic fibers, particularly noticeable in the sclera of the eyes. Understanding this phenomenon is vital for early recognition of liver pathology. Situation 5. Changes in urine and feces color. Liver cancer can also impact the liver's ability to process and eliminate bilirubin, leading to observable changes in urine and feces. Increased direct bilirubin in the liver spills into the bloodstream and is subsequently excreted through the urine, resulting in a darker, cola-like color. Conversely, when bilirubin cannot access the small intestine, its natural pathway, this inhibits the formation of urobilinogen, the pigment that colors stool. As a result, feces may become increasingly pale, and in cases of total bile outflow obstruction, they may turn white. These changes in excretory products are critical diagnostic clues in assessing liver function and health. Situation 6. Ascites due to altered portal venous circulation. In the realm of liver oncology, we often encounter a condition known as ascites, a direct consequence of liver cancer affecting the portal venous system. This system, crucial for transporting blood from abdominal organs to the liver, faces increased pressure when disrupted by liver cancer. As a result, fluid escapes from these vessels and accumulates in the peritoneal cavity, leading to abdominal swelling. In severe cases, the volume of acidic fluid becomes so significant that it necessitates medical drainage. This is because excessive fluid can elevate the diaphragm, impeding lung expansion and causing considerable respiratory distress. Patients with this condition often experience marked difficulty in breathing due to restricted air entry into the lungs. Situation 7. Fever, fatigue, and weight loss. As liver cancer progresses, it behaves like a parasitic entity within the body, siphoning energy from the host's nutritional intake. This phenomenon, common to many cancers, results in the rapid turnover of tumor cells, a process markedly faster than that of healthy cells. Consequently, our bloodstream becomes inundated with debris from these dying cells. This can lead to systemic intoxication, manifesting as fatigue and weight loss, as the body struggles to cope with the increased metabolic demands and toxin clearance. Furthermore, the presence of these cellular fragments in the bloodstream can interfere with the brain's thermoregulatory center. When these fragments pass through this area, responsible for body temperature regulation, they can induce mild fever by disrupting the normal neuronal activity within this center. Situation 8. Skin rash. In the clinical spectrum of liver cancer, one symptom that often goes underrecognized is the development of skin rashes. These dermatological manifestations can be a direct consequence of the systemic impact of liver cancer on the body's immune and metabolic systems. When the liver, a vital organ for detoxification and metabolism, is compromised by cancer, it can lead to an accumulation of toxins and metabolic byproducts in the bloodstream. These substances can trigger inflammatory responses in the skin, presenting as rashes. From a medical standpoint, these rashes can vary in appearance, ranging from small, pinpoint red spots known as petechiae, which result from minor hemorrhages, to larger patches of discolored skin. In some cases, the rashes may be pruritic, causing significant itching and discomfort. This itching is often a result of the accumulation of bile salts in the skin due to impaired liver function. We have seen the symptoms that can cause liver cancer when it has grown within the liver itself. And what happens when the tumor escapes outside the liver? Which are the ways it can escape? What symptoms can occur if it escapes? Let's answer these questions. When the tumor is already outside the liver, maybe because it has escaped by one or more of these 4 ways. Liver cancer grows so much that it infiltrates neighboring organs and structures. Tumor breaks the peritoneum and spreads through the abdominal cavity. Liver cancer escapes through the lymphatics. Or tumor cells enter the blood. Let's see where each of these 4 ways leads liver cancer cells. Situation 1. Tumor growth and infiltration of neighboring structures. When liver cancer reaches a significant size, it has the potential to infiltrate adjacent organs, such as the gallbladder, right adrenal gland, or the large intestine. Notably, it may also extend upwards to infiltrate the diaphragm, the muscle delineating the chest and abdominal cavities. This expansive growth can disrupt the gallbladder and bile ducts, impeding bilirubin elimination. Consequently, patients may experience intensified symptoms like pale stools, dark urine, and aggravated jaundice. Additionally, diaphragmatic irritation by the tumor can lead to persistent hiccups, a symptom that can severely diminish the patient's quality of life. Situation 2. Peritoneal spread and peritonitis. As the tumor enlarges, it may breach the liver's capsule and spread into the peritoneal cavity. Here, cancer cells can disseminate and implant on the surfaces of various abdominal organs. This process can result in symptoms of peritonitis, characterized by diffuse abdominal pain due to peritoneal irritation. When these tumor implants compress the small intestine from the outside, they can cause bowel obstruction, leading to symptoms like subocclusion or complete intestinal obstruction. Situation 3. Lymphatic spread and biliary compression. Liver cancer can also metastasize via the lymphatic system. Initially, cancer cells often accumulate in the lymph nodes around the hepatic hilum, where the liver's blood vessels and bile ducts converge. This nodal involvement can lead to symptoms of bile duct compression, blocking bile flow and causing an increase in blood and urine bilirubin levels. The feces may lose their brown color, appearing pale or white. Subsequently, cancer cells can spread to more distant lymphatic regions, though these metastases may not always produce noticeable symptoms. Situation 4. Hematogenous spread to lungs and bones. Another pathway for liver cancer metastasis is through the bloodstream. Once inside the blood vessels, cancer cells can travel to distant sites like the lungs and bones. Lung metastases often present as multiple nodules and can lead to symptoms like breathing difficulties, persistent dry cough, and in some cases, hemoptysis if a blood vessel is involved. Bone metastases, on the other hand, can cause severe pain, particularly if the tumor invades and disrupts the periosteum or compromises the structural integrity of weight-bearing bones. Vertebral involvement can lead to back pain and, in severe cases, spinal cord compression syndrome, presenting with various neurological symptoms. As demonstrated, liver cancer's progression, whether within the liver or metastasized to distant sites, can manifest a plethora of signs and symptoms, necessitating a vigilant and comprehensive approach in its diagnosis and management. Today, we're diving into a critical topic: your liver health. Did you know that 1 in 3 people has fatty liver disease? This condition can lead to various health issues, including fat gain around the belly, high blood pressure, and a higher risk of diabetes. Poor lifestyle choices, unhealthy eating habits, and exposure to harmful substances can cause liver disease. In today's video, we'll discuss 10 everyday habits that harm your liver and offer simple solutions to fix them. Remember, this video is for educational purposes only, so please consult your doctor if you have any medical concerns. 1. Excessive alcohol consumption. Excessive alcohol consumption is one of the most damaging habits for your liver. When you drink alcohol, your liver works hard to break it down and remove it from your bloodstream. Over time, consuming too much alcohol overwhelms the liver, leading to a buildup of fat and toxins within liver cells. This can cause fatty liver disease, where fat accumulates in the liver, impairing its ability to function properly. Continued heavy drinking can progress to alcoholic hepatitis, which is inflammation of the liver, and eventually to cirrhosis, a condition where healthy liver tissue is replaced with scar tissue, severely affecting liver function. Cirrhosis is irreversible and can lead to liver failure, which is life-threatening. To protect your liver, it is crucial to limit alcohol intake. For men, this means no more than 2 drinks per day, and for women, no more than 1 drink per day. Abstaining from alcohol or drinking in moderation can significantly reduce the risk of liver damage and support overall liver health. 2. Poor sleep habits. Poor sleep habits can have a detrimental impact on liver health. When you don't get enough sleep or have irregular sleep patterns, it disrupts your body's circadian rhythms, which play a crucial role in regulating liver function. The liver performs many of its detoxification and regenerative processes during restful sleep. Lack of sleep can impair these processes, leading to an accumulation of toxins and oxidative stress in the liver. Additionally, poor sleep is associated with metabolic imbalances that can contribute to the development of non-alcoholic fatty liver disease, NAFLD. This condition is characterized by fat buildup in the liver, which can progress to inflammation and liver damage. To support liver health, it is important to maintain good sleep hygiene. Aim for 7 to 9 hours of quality sleep each night, establish a regular sleep schedule, and create a calming bedtime routine. 3. High caffeine intake. Excessive caffeine intake is another habit that can negatively affect liver health. While moderate consumption of caffeine, such as drinking coffee or tea, has been shown to have some health benefits, overconsumption can strain the liver. The liver metabolizes caffeine, and too much of it can overload this vital organ, leading to increased liver enzyme levels and potential liver damage. High caffeine intake is often linked with the consumption of energy drinks, which can contain extremely high levels of caffeine along with other harmful substances like added sugars and artificial ingredients. This combination can exacerbate the liver's workload, leading to inflammation and oxidative stress. Moreover, excessive caffeine can disrupt sleep patterns, indirectly affecting liver health by impairing the body's natural detoxification processes during sleep. To protect your liver, it is essential to moderate your caffeine intake, aiming for no more than 400 milligrams per day, equivalent to about 4 cups of coffee. 4. Skipping meals. Skipping meals is a habit that can negatively impact liver health. When you skip meals, it disrupts your body's regular metabolic processes, leading to fluctuations in blood sugar levels. These fluctuations can strain the liver as it works to maintain glucose balance and supply energy to the body. Skipping meals also triggers the liver to convert stored glycogen into glucose, depleting its glycogen reserves and impairing its ability to perform other essential functions. Moreover, irregular eating patterns can contribute to the development of non-alcoholic fatty liver disease, NAFLD, by promoting insulin resistance and increasing the likelihood of overeating during subsequent meals. This can lead to weight gain and fat accumulation in the liver. To support liver health, it is important to maintain regular, balanced meals that provide consistent energy and nutrients. Eating at regular intervals helps stabilize blood sugar levels, reduces stress on the liver, and promotes overall metabolic health. 5. Excessive salt intake. Excessive salt intake is a habit that can have detrimental effects on liver health. High sodium levels can cause the body to retain excess fluid, leading to increased blood pressure and placing additional strain on the liver. This is particularly concerning for individuals with liver conditions such as cirrhosis, where the liver is already compromised and more susceptible to damage from fluid retention. Furthermore, a diet high in salt can contribute to the development of non-alcoholic fatty liver disease, NAFLD, by promoting insulin resistance and obesity, both of which are risk factors for liver disease. Processed foods and restaurant meals are often significant sources of hidden sodium, making it easy to consume more than the recommended daily limit of 2,300 milligrams. To protect your liver, it is essential to monitor and reduce your salt intake. Choose fresh, whole foods over processed options, cook meals at home to control salt levels, and use herbs and spices to flavor food instead of salt. 6. Ignoring hydration needs. Ignoring hydration needs is a habit that can significantly impact liver health. The liver relies on adequate hydration to perform its detoxification processes effectively. Water helps to flush toxins out of the body and supports the liver in breaking down substances and removing waste products. When you don't drink enough water, it can lead to dehydration, which thickens the blood and makes it more difficult for the liver to filter toxins. Dehydration also reduces the volume of blood flowing through the liver, impairing its ability to function optimally. This can lead to the accumulation of toxins in the liver and body, increasing the risk of liver damage over time. To support liver health, it is essential to stay properly hydrated by drinking sufficient water throughout the day. Aim for at least 8 glasses of water daily, more if you are active or in a hot climate. 7. Overuse of herbal supplements. Overuse of herbal supplements is a habit that can harm liver health. While many people take herbal supplements for their perceived health benefits, it's essential to recognize that not all supplements are safe, especially in large quantities. Some herbs, such as kava, comfrey, and certain weight loss or bodybuilding supplements, can be toxic to the liver. These supplements may contain compounds that cause liver inflammation, damage liver cells, or interfere with liver function. Additionally, the lack of regulation in the supplement industry means that products can vary widely in quality and potency, sometimes containing harmful contaminants or adulterants. Over time, the liver can become overwhelmed trying to metabolize these substances, leading to liver injury or even liver failure. To protect your liver, it is crucial to use herbal supplements cautiously and under the guidance of a healthcare professional. Opt for supplements from reputable sources, follow recommended dosages, and avoid combining multiple supplements without medical advice. 8. Consuming processed foods. Consuming processed foods regularly is a habit that can severely damage liver health. Processed foods are often high in unhealthy fats, sugars, and additives, all of which place a significant burden on the liver. These foods typically contain trans fats, which can lead to increased fat accumulation in the liver, contributing to non-alcoholic fatty liver disease, NAFLD. Additionally, processed foods are often laden with high fructose corn syrup, which can exacerbate liver fat accumulation and cause insulin resistance. The additives and preservatives in processed foods also introduce toxins that the liver must work hard to filter out, further straining this vital organ. Over time, the continuous consumption of such foods can lead to chronic inflammation, liver damage, and a higher risk of developing liver-related diseases. To support liver health, it is essential to minimize the intake of processed foods and focus on a diet rich in whole, natural foods like fruits, vegetables, lean proteins, and whole grains. 9. Frequent use of artificial sweeteners. Frequent use of artificial sweeteners is a habit that can adversely affect liver health. Artificial sweeteners, such as aspartame, saccharin, and sucralose, are commonly used as sugar substitutes in various diet and sugar-free products. While they are marketed as healthier alternatives to sugar, excessive consumption of these sweeteners can have negative implications for liver function. Studies have shown that high intake of artificial sweeteners can disrupt the gut microbiota, leading to inflammation and increased liver fat accumulation. This, in turn, can contribute to the development of non-alcoholic fatty liver disease, NAFLD. Additionally, some artificial sweeteners can create a metabolic burden on the liver as it processes these unnatural compounds. To protect your liver, it is advisable to limit the use of artificial sweeteners and opt for natural alternatives, such as stevia or small amounts of honey, whenever possible. Maintaining a diet based on whole, unprocessed foods can further support liver function and overall health. 10. Ignoring liver health checks. Ignoring liver health checks is a habit that can have serious consequences. Liver diseases often progress silently, without noticeable symptoms until significant damage has occurred. Regular liver health checks and screenings can help detect issues early, allowing for timely intervention and treatment. If liver disease is detected early, lifestyle changes, medications, and other treatments can be more effective in preventing further damage. Regular checkups are particularly important for individuals with risk factors such as obesity, diabetes, excessive alcohol consumption, or a family history of liver disease. To protect your liver health, schedule regular visits with your healthcare provider and discuss any concerns you may have. Early detection and proactive management are key to maintaining a healthy liver and preventing serious complications. Reversing liver damage, your path to a healthier liver. As we've mentioned before, the liver is one of the few organs capable of completely healing itself. So, if you've had some bad habits for years, don't worry. You can still make a change. Here are some effective methods to help repair your liver. 1. Boost your glutathione levels. Start by increasing your master antioxidant, glutathione, with sulfur-rich foods. Add more garlic, onions, radishes, scallions, cabbage, mushrooms, pasture-raised eggs, artichokes, leafy greens, wild salmon, and broccoli sprouts to your diet. These foods are fantastic for detoxifying your liver and boosting its healing power. 2. Milk thistle magic. Take 2,400 milligrams of freeze-dried milk thistle 3 times a day. Milk thistle is a powerhouse herb packed with silymarin, a group of compounds that regenerate liver tissue. Spread out your doses throughout the day for maximum effect. 3. Embrace autophagy. Give your liver a break by adopting an 8-hour eating window and drinking only water for the remaining hours. This stimulates autophagy, a cellular cleanup process that repairs cells in your liver and body. It's like a spa day for your liver. 4. Avoid harmful toxins. Cut out damaging substances such as fructose, alcohol, drugs, vapes, painkillers, refined carbs, and high-mercury fish. Removing these toxins allows your liver to heal. Check out my other videos for natural alternatives to meet all your needs. 5. Increase bile production. Support your liver by increasing bile production to dissolve fatty deposits. Take a daily supplement with at least 100 milligrams of ox bile 3 times per day after meals. Also, drink at least 1 liter of water daily, as bile is 95% water. Boost bile further by consuming choline-rich foods like eggs, wild fish, and beef. 6. Boost your omega-3s. Reduce liver inflammation by eliminating inflammatory seed oils like canola, cottonseed, soy, corn, and rapeseed oil. Increase your omega-3 intake with wild fish, shellfish, grass-fed beef, or a virgin cod liver oil supplement every day. 7. Load up on antioxidants. Combat free radical damage by loading up on antioxidants. Incorporate blueberries, regular exercise, organ meats, Brazil nuts, oily fish, sauerkraut, turmeric, parsley, and vitamin D3 into your routine. These will help reverse the damage and rejuvenate your liver. Imagine being able to cleanse your liver and detoxify your body effectively in just a few days. This not only makes you feel healthier but also boosts your overall well-being and mental clarity. Today, I'm going to show you how to cleanse your liver in just 3 days. I've tried countless liver cleanses before, many of which left me feeling ill and bedridden for weeks. But the liver cleanse I'm about to share with you is different and far more effective. Unlike the usual methods involving apple cider vinegar, lemon drinks, or ginger, this cleanse delivers much more impressive results. Let's explore this powerful liver cleanse together and experience the remarkable difference it can make. The question is, how does your liver actually clean the body? What are the most powerful ways to speed up this process? The liver plays a crucial role in detoxifying poisons and chemicals, including medication, chemicals in food, and alcohol. It also cleans out dead cells, waste, and pathogens like microbes, viruses, bacteria, and fungi from the body. If you've ever taken biology, you'll know that inside a cell there are various components, including lysosomes. Lysosomes act like garbage disposals, burning up waste and cleaning up dead cells. They help recycle dead cells and pathogens, transforming them into new cells. This entire process is known as autophagy, where the body essentially eats some of its own tissue and recycles waste into new cells. By understanding and supporting these processes, we can help the liver function more effectively and speed up detoxification. Now, let's discuss 7 triggers for autophagy, starting with the weakest. Certain phytonutrients have a mild effect on triggering autophagy and this recycling process. Then at number 6, we have the ketogenic diet, which involves cutting down your carbohydrates. Number 5 is exercise. Exercise will trigger autophagy. Following that, we have sleep. During sleep, your body undergoes autophagy. Next is calorie restriction. Reducing your calorie intake also promotes this process. At number 2, we have water fasting, where you consume only water and no food, which is a powerful way to stimulate autophagy. However, there is one method that is 3 times more effective than water fasting. Are you ready? It's dry fasting, no food and no water. Dry fasting is arguably the most powerful way to stimulate autophagy and deeply cleanse the cells. I'm not talking about dry fasting for 12 days, that's for another discussion. I'm talking about dry fasting for just a day. You start at sunrise and break the fast at sunset. Initially, I was skeptical, but the more I tried it, the more amazed I was. 1 day of dry fasting is equivalent to 3 days of water fasting. You've probably heard that you can only survive 3 days without water. That's a myth. When you stop drinking water, your fat cells release a lot of water as they burn. But for our purposes, we're only talking about 12 hours without water. You'll be fine and will greatly enhance your immune system. Another benefit is that your kidneys and liver get a chance to rest. Often, we think we need to drink lots of water to flush out toxins. But guess what happens when you drink a lot of water? You end up urinating frequently, which makes your kidneys work hard to eliminate the excess water. Dry fasting also boosts mental clarity, promotes the growth of new brain cells, and reduces inflammation. Plus, you'll get additional dry fasting hours while you sleep, further enhancing the benefits. The second part of this cleanse focuses on eliminating toxins, poisons, and chemicals from the body. This process primarily takes place in the liver and kidneys, but also involves other parts of the body. Enzymes play a key role by breaking down these harmful substances into harmless components. This program resembles OMAD, 1 meal a day, where you eat 1 meal at sunset. This meal consists of 2 main components, a cruciferous vegetable and a protein source. Cruciferous vegetables. Examples include broccoli, Brussels sprouts, cauliflower, arugula, broccoli sprouts, kale, bok choy, and cabbage. Broccoli sprouts are particularly potent, being 20 to 50 times stronger than mature broccoli. You can enjoy these vegetables in salads, smoothies, or fermented forms like raw sauerkraut. Protein. Meat is rich in amino acids, which are the building blocks of proteins. Specific amino acids, such as glutamine, help boost glutathione production. Glutathione is a powerful antioxidant that helps eliminate free radicals and prevents oxidative stress. Meat also provides iron and B vitamins, which support detoxification. Combining this dietary approach with dry fasting creates a powerful detoxification strategy. You will do this cleanse 3 days a month. Preventing detox reactions. To avoid adverse detox reactions that some people experience during cleansing, it's important to ensure there are no blockages in the bile ducts, which connect the liver and gallbladder. Bile sludge or gallstones can cause toxins to back up into the liver, leading to illness. To prevent this, consider taking bile salts as a supplement before starting the cleanse. This helps keep the bile ducts clear and supports the detoxification process. You can also use certain foods to help thin the bile. One of the best options for thinning bile is consuming beets. Additionally, apple cider vinegar mixed with water can be very effective. Sometimes, people start a cleanse and experience severe constipation due to a blockage in their bile ducts. In such cases, I recommend taking bile salts on an empty stomach. This helps to open up the bile ducts and relieve the blockage within hours. After learning these powerful techniques for cleansing your liver and body, start applying them today to experience the positive changes for yourself. Fast food, it's quick, it's tasty, and it's everywhere. From burgers and fries to pizza and fried chicken, these convenient meals have become a staple in many of our diets. However, have you ever stopped to think about what all that fast food might be doing to your liver? Today, we're diving deep into the impact of fast food on your liver health. How exactly does fast food harm your liver, and what can you do to protect yourself while still enjoying the convenience of these meals? Stay tuned as we explore the answers to these critical questions. So, let's get started. Fast food has become an integral part of modern life due to its convenience, affordability, and appealing taste. From burgers and fries to pizza and fried chicken, these quick meals are easily accessible and often irresistible. However, while indulging in fast food occasionally might seem harmless, regular consumption can have significant adverse effects on our health, particularly on the liver. Fast food is typically high in unhealthy fats, sugars, and salt, while being low in essential nutrients. This combination can lead to various health issues, including obesity, heart disease, and type 2 diabetes. One of the most concerning effects of regular fast food consumption is its impact on liver health. The liver is responsible for detoxifying harmful substances, metabolizing fats, and regulating blood sugar levels. When overwhelmed by the unhealthy components of fast food, the liver can suffer severe damage. Harmful effects on the liver. 1. Fatty liver disease. Fast food, characterized by its high content of unhealthy fats, sugars, and salt, has become a dietary staple for many due to its convenience and taste. However, frequent consumption of fast food poses a significant risk to liver health, particularly leading to the development of non-alcoholic fatty liver disease, NAFLD. This condition, often associated with poor dietary habit, NAFLD is characterized by the accumulation of fat in liver cells in individuals who consume little to no alcohol. The pathogenesis of NAFLD is multifactorial, involving genetic predisposition, insulin resistance, oxidative stress, and inflammatory responses. Fast food is rich in saturated fats and trans fats, which are readily stored in the liver. When the intake of these unhealthy fats exceeds the liver's capacity to process and metabolize them, fat starts accumulating in liver cells, leading to hepatic steatosis, the hallmark of NAFLD. High sugar levels, particularly from refined sugars and high fructose corn syrup commonly found in fast foods, contribute to insulin resistance. Insulin resistance impairs the body's ability to regulate glucose, causing increased fat synthesis in the liver. This process exacerbates the accumulation of fat in liver cells, promoting the progression of NAFLD. The presence of excessive fatty acids in the liver triggers oxidative stress and the production of inflammatory cytokines. This inflammatory response can cause hepatocellular injury and fibrosis, further advancing NAFLD to non-alcoholic steatohepatitis, NASH, a more severe form of liver disease characterized by liver inflammation and damage. 2. Toxin overload. The liver's role in detoxification involves metabolizing and neutralizing harmful substances, which are then excreted from the body. However, the constant influx of toxins from regular fast food consumption can overwhelm the liver's capacity, leading to several detrimental effects. Fast foods often contain preservatives like sodium benzoate, nitrates, and nitrites, as well as artificial colors and flavors. These substances, while preventing spoilage and enhancing appearance, require extensive processing by the liver. Over time, the chronic exposure to these chemicals can lead to liver cell damage and impaired liver function. Trans fats and hydrogenated oils, commonly found in fried and processed fast foods, increase inflammation and oxidative stress in the liver. The liver's attempt to process and eliminate these harmful fats results in the production of reactive oxygen species, ROS, which can damage liver cells and promote fibrosis. High fructose corn syrup, HFCS, frequently used in sodas and sweetened fast food items, is metabolized in the liver, leading to the production of harmful substances like uric acid and free radicals. This metabolic burden increases the risk of liver inflammation and fat accumulation, contributing to non-alcoholic fatty liver disease, NAFLD, and other liver disorders. Additionally, certain fast food packaging materials contain chemicals like bisphenol A, BPA, and phthalates, which can leach into the food. These endocrine disruptors interfere with hormonal balance and liver function, further exacerbating the toxic load on the liver. 3. Obesity. Obesity, characterized by excessive body fat accumulation, poses numerous health risks, including severe implications for liver health. Understanding the relationship between fast food consumption, obesity, and liver disease is crucial for addressing this growing public health. Obesity results from an imbalance between caloric intake and energy expenditure, where excessive calories are stored as fat in the body. Fast food, often rich in fats, sugars, and refined carbohydrates, provides a surplus of calories while offering little nutritional benefit. This caloric surplus easily leads to weight gain and obesity. Fast food's poor nutritional quality, lacking essential nutrients like fiber, vitamins, and minerals, can lead to overeating as the body continues to crave nutrients, further exacerbating weight gain. High sugar content, particularly from fructose and refined carbohydrates, promotes insulin resistance, impairing the body's ability to regulate blood sugar levels and leading to increased fat storage, particularly in the abdominal area. Additionally, obesity is associated with a chronic inflammatory state, as adipose tissue produces inflammatory cytokines that contribute to systemic inflammation, impacting various organs, including the liver. Obesity significantly increases the risk of liver-related health issues, particularly non-alcoholic fatty liver disease, NAFLD. In individuals with obesity, the excess fat stored in the liver can lead to hepatic steatosis, the initial stage of NAFLD. If left unchecked, this condition can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and eventually cirrhosis or liver cancer. Insulin resistance, common in obese individuals, exacerbates NAFLD by overwhelming the liver with excess fat and impaired insulin signaling, causing further fat accumulation and liver damage. The chronic inflammation associated with obesity promotes liver inflammation, leading to hepatocellular injury and stimulating fibrogenesis, where excess connective tissue builds up in the liver, leading to fibrosis and potentially cirrhosis. Furthermore, obesity, particularly abdominal obesity, is linked with metabolic syndrome, which includes conditions like hypertension, dyslipidemia, and type 2 diabetes, compounding liver-related issues as the liver is central to lipid and glucose metabolism. 6 prevention strategies for liver health and obesity. Given the significant health risks associated with fast food consumption, obesity, and liver diseases such as non-alcoholic fatty liver disease, NAFLD, it is crucial to implement effective prevention strategies. These strategies can help mitigate the harmful effects of an unhealthy diet and lifestyle, promoting overall well-being and protecting liver health. Here are some key prevention methods. Dietary modifications. Reduce fast food intake. Limit the consumption of fast foods that are high in unhealthy fats, sugars, and refined carbohydrates. Instead, opt for homemade meals prepared with fresh ingredients. Balanced diet. Emphasize a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. These foods provide essential nutrients and help maintain a healthy weight. Fiber-rich foods. Incorporate more fiber into your diet through fruits, vegetables, legumes, and whole grains. Fiber aids in digestion and helps regulate blood sugar levels, reducing the risk of insulin resistance. Healthy fats. Choose sources of healthy fats such as avocados, nuts, seeds, and olive oil, which are beneficial for liver health and overall well-being. Regular physical activity. Exercise routine. Engage in regular physical activity, including both aerobic exercises, such as walking, running, cycling, and strength training. Aim for at least 150 minutes of moderate intensity exercise per week. Active lifestyle. Incorporate more movement into your daily routine by taking the stairs, walking instead of driving short distances, and participating in recreational activities. Behavioral interventions. Mindful eating. Practice mindful eating by paying attention to hunger and fullness cues, eating slowly, and avoiding distractions such as TV or smartphones during meals. Portion control. Be mindful of portion sizes to avoid overeating. Use smaller plates and bowls to help manage portion sizes. Healthy snacking. Choose healthy snacks such as fruits, nuts, yogurt, or vegetables instead of processed snacks high in sugar and fat. Hydration. Adequate water intake. Stay hydrated by drinking plenty of water throughout the day. Proper hydration supports liver function and overall health. Limit sugary drinks. Reduce the consumption of sugary beverages such as sodas, energy drinks, and sweetened juices, which can contribute to weight gain and liver fat accumulation. Medical monitoring and interventions. Regular check UPS. Schedule regular health checkups, including liver function tests and imaging studies, to monitor liver health and detect any early signs of liver disease. Professional guidance. Seek advice from healthcare professionals, including dietitians and physicians, to develop personalized dietary and exercise plans. Medical interventions. In cases of severe obesity or advanced liver disease, medical or surgical interventions such as pharmacotherapy or bariatric surgery may be necessary. These should be discussed with a healthcare provider. Avoidance of toxins. Reduce exposure. Limit exposure to environmental toxins and chemicals found in certain food packaging materials, such as bisphenol A, BPA, and phthalates. Choose fresh, whole foods over processed and packaged options. Safe food practices. Practice safe food handling and storage to avoid contamination and reduce the intake of preservatives and additives. In conclusion, understanding the harmful effects of fast food on our liver and overall health is crucial. By making informed food choices, adopting a balanced diet, staying active, and practicing mindful eating, we can significantly reduce the risk of obesity and liver diseases. Remember, small changes in our daily habits can lead to big improvements in our health. So, let's take action today to protect our liver and enjoy a healthier life. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to our channel for more health tips and insights. Hit the bell icon to stay updated with our latest videos. Thank you for watching, and take care of your health.